This video is intended for informational purposes as an initial guide to managing chronic inflammation. For personalized advice and treatment, please consult with your healthcare provider. In our last video, we explored chronic inflammation, a condition where inflammation becomes a constant, detrimental presence in our bodies, leading to serious health issues like heart disease and diabetes. Today, we delve into managing chronic inflammation with lifestyle changes through the Melelo Body Rebalancing Approach. Almost all chronic diseases, also known as chronic conditions or non-communicable diseases, result from chronic inflammation. The Melelo Body Rebalancing Approach is an intensive short-term plan designed to undo as much chronic inflammation as possible. Before delving into the gist of Melelo's Body Rebalancing Approach, it is fitting to highlight some common effects that may result from chronic inflammation. If you experience any of the following things, it may be a result of chronic inflammation, meaning the Melelo Body Rebalancing Approach could be for you. 1. Destruction of collagen. Inflammation speeds up the breakdown of collagen, resulting in premature aging. This may be evidenced by early wrinkles due to skin elasticity loss, which is inconsistent with your chronological age. 2. Increased risk of chronic diseases. Chronic inflammation is associated with a higher risk of developing conditions such as heart disease, diabetes, some cancers, and autoimmune disorders, to name a few. 3. Impaired immune function. Prolonged inflammation can disrupt the normal functioning of the immune system, leading to increased susceptibility to infections and a compromised ability to fight off pathogens. 4. Negative impact on mental health, mood disorders. Chronic inflammation has been linked to an increased risk of depression, anxiety, and cognitive decline. 5. Joint and muscle pain. Chronic inflammation can contribute to the development of conditions such as arthritis, fibromyalgia, and tendinitis, leading to persistent pain and reduced mobility. 6. Metabolic dysfunction. Persistent inflammation can disrupt normal metabolic processes, leading to insulin resistance, weight gain, and an increased risk of metabolic syndrome. 7. Impact on cardiovascular health. Chronic inflammation can contribute to the development and progression of atherosclerosis, a condition characterized by the buildup of plaque in the arteries, leading to an increased risk of heart attacks and strokes. 8. Impaired wound healing. Ongoing inflammation can interfere with the normal healing process, delaying the repair of injured tissues and increasing the risk of infections. 9. Altered gut health. Chronic inflammation in the digestive system can disrupt the balance of gut bacteria, leading to gastrointestinal disorders such as inflammatory bowel disease and leaky gut syndrome. 10. Impact on sleep quality. Inflammation can disrupt normal sleep patterns, leading to insomnia or poor sleep quality, further contributing to overall health issues. 11. Impaired lung function. Inflammatory lung diseases such as asthma and chronic obstructive pulmonary disease, COPD, involve chronic inflammation, reducing lung function and respiratory symptoms. Addressing chronic inflammation involves a multifaceted approach, including nutritional changes and medical interventions. Our focus today is on a dietary approach to rebalance your body and reduce inflammation. This approach has been used and proven to work effectively. 3 real-life examples outlined in this video demonstrate the efficacy of this approach, where the protocol has yielded positive results. However, before taking a deep dive, we must stress certain things you should be aware of from the onset. First, you need to work closely with your healthcare provider, especially if you have a long-term condition that your healthcare provider is managing, as what is explained in this video will likely impact your care management. If you are on medication, continue taking your prescription per the schedule your healthcare provider advised. A side note about medicines for chronic conditions. In most cases, conventional medicines usually only treat the symptoms of chronic diseases without addressing the root cause of the problem. Notwithstanding, these medicines are essential in alleviating pain and even averting emergencies, for example, stroke in high blood pressure cases. While medication may be vital in managing chronic diseases, lifestyle adjustments are also crucial for long-term improvement. Adopting a healthier lifestyle, such as engaging in regular physical activity, maintaining a balanced diet, managing stress and getting enough rest, can contribute significantly to overall well-being and potentially help mitigate the impact of whatever chronic condition one has. As your lifestyle improves, the chronic condition besetting you, for example blood pressure, will surely decrease. Your healthcare provider will assess your progress and adjust the medication dosage accordingly. This process may continue until you are gradually weaned off your medications. I repeat, under the supervision of your healthcare provider. Another thing I want to say is that we are all unique, and each condition is unique. Here are some examples of remarkable results achieved by the Melelo protocol. While the names used in these examples are fictitious, the situations described are real. Example 1, cervical cancer and quality of life improvement. Mary, a lady in her early 70s, had stage 4 cervical cancer. Mary had mobility issues because of back pain that could not be resolved. She also experienced vaginal bleeding at her postmenopausal age due to cancer and was generally unwell with a debilitating weakness. As a result, Mary spent most of her time sleeping or just seated. Doing household chores was extremely taxing to her as she quickly got tired. After consultation, Melelo introduced Mary to the Melelo Body Rebalancing Approach. Mary opted for Protocol 2, described later, and spent 3 weeks on the course. After 2 weeks, there was a remarkable change in her condition. The back pain disappeared and the vaginal bleeding stopped. Before the end of 3 weeks, Mary was up and about as she used to be before the effects of cancer immobilized her. She even mistakenly thought she was healed of cancer. Example 2, prediabetes and high cholesterol. John, a high-flying executive, was diagnosed with high cholesterol and prediabetes in his early 40s. The diagnosis shocked him profoundly as he thought he was a healthy man. John was a gym enthusiast but had one weakness that he confessed about. John survived on fast food from the high street for his lunch. John incorrectly assumed that going to the gym would undo the effects of his poor diet, a mistake that most people make. Usually most people binge on unhealthy stuff and assume that the gym would be a silver bullet to reverse or prevent the effects of their eating habits. While the gym and exercise are crucial core components of the optimal lifestyle, they cannot undo all the effects of unhealthy eating, as we will see later. Back to John. After his diagnosis, his medical doctor put him on a 6-month diet to resolve his condition. John approached Melelo for advice on how he could adjust his lifestyle to resolve his recent diagnosis. Melelo recommended one of the protocols, Protocol 1, in the Melelo Body Rebalancing Approach. It is the one that starts with fasting and then the specified diet. John was on the protocol for 10 days. After 10 days, Melelo asked John to go back to his doctor for blood tests. John's doctor was gobsmacked by the laboratory results, which were all back to normal readings. The doctor told John that he had never seen something like this in his many years of practice. Even his trainer at the gym noticed the difference and started referring some of his clients who were struggling with weight issues to the Melelo Body Rebalancing Approach course. Example 3, tonsillitis. Julie, in her 30s, was due for a tonsillectomy, which is the surgical removal of her tonsils as she experienced crippling recurrent infections. Julie managed her condition with conventional medicines, which only addressed the symptoms, but could not get rid of the root cause. The next step in the medical team's plan for Julie was the removal of her tonsils. Before that happened, Julie asked Melelo for advice on whether there was anything she could do. Melelo proposed lifestyle changes, including diet. At the time, Melelo put Julie on oranges for 1 week. While fruits like oranges are beneficial for a healthy lifestyle, they may not be the best option on their own for addressing chronic inflammation during the rebalancing phase. The use of sweet fruits in combating inflammation is often discouraged due to the sugar content, which can potentially exacerbate inflammation. At any other time outside the rebalancing phase, please eat the fruits whole. Avoid fruit juices as they are concentrated in sugar. Whole fruits can mitigate this negative effect, as they contain fiber and other beneficial nutrients that help counterbalance the impact of sugar. Back to Julie. Julie made a remarkable recovery from her tonsillitis, and surgery was not necessary anymore. Julie adopted a healthy lifestyle, and more than 20 years later, she still had no recurrent infection and no surgery. We will now focus on the different Melelo Body Rebalancing Approach protocols. The Melelo Body Rebalancing Approach is based on a nutritional intervention designed to target acidosis and chronic inflammation, often behind many diseases. As mentioned earlier, If you have long-standing health conditions under healthcare management, please inform your healthcare provider about what you would be about to do to ascertain if the things you eat will not clash with your medication. Also, continue taking your prescribed medication. You are highly likely to get improvement in your condition so much that your healthcare provider might need to adjust your medication dosage in line with the new health assessment readings. The approach consists of 2 broad protocols based on your health. The first protocol incorporates fasting, while the second does not. Protocol 1. On this protocol, you will begin with a fast as part of the rebalancing process. This protocol achieves body rebalancing quickly.